Thank you. First of all, in healthcare, we're always talking about serious stuff, so I just want to observe that this is the first time I'm wearing jeans at a formal talk, and it's really exciting. Josh and I are really excited to be here because so many friends and partners in this room have taught us about imagination and courage and how putting those two together you could take on the biggest problems in this world. And we know that firsthand. When I was a fellow and giving a talk 3 years ago, Last Mile Health was still working out of a bombed-out building in a rainforest that had started with just $5,000 from a wedding donation. Since then, we have deployed 150 professionalized community health workers who've done over 100,000 home visits. And in Konobo district, one of the most remote areas of Liberia in the world, we've been able to triple access to care for women and children. Today, 5 times as many children get immunized. Today, 2 times as many children get access to malaria and pneumonia treatment, and nearly all the mothers get access to prenatal care. With people in this room, we are saving lives where no one thought it was possible. No good work is the work of one person or one organization, but rather the work of many. And as I think about the people I just met an hour ago in the audience, people who have helped us design our work, mentored us, taught us how to share the meaning behind our work, helped us build our organization and our resources, I can truly say that this has been a co-creation from this community.
So when I was here as a fellow just a few years ago, we were supporting 75 community health workers. And by the end of this year, Medic Mobile will be helping 16,000 health workers in 20 countries. And these systems now reach 7.5 million people. And we're seeing really exciting results. In India, we saw a text messaging system increase childhood vaccinations from 60% to 99%. In East Africa, in Malawi and Kenya, we're now tracking disease outbreaks and stockouts 134 times quicker than before. There are now thousands of these remote health workers who are connected to support teams at local clinics for the first time ever. And I've had the honor of working with a lot of the people in this room. And I have to say, I blame you all for most of my optimism, because I see the world getting better one fellow at a time.
The reason for the successes that Medic has had across the world and Last Mile Health has had in Liberia really boils down to a pretty basic idea: to reimagine a new opportunity in what's been an idea that's been around for a long time. Community health workers are not new. They've been around for decades. But they've failed people in last mile villages because health systems undervalue them, and because they undervalue them, community health workers don't get the support they need to perform. Let me tell you what I mean. Status quo around the world is for a village chief to nominate a woman like Zakpa, who's not had a chance to finish middle school and has not had a job. And without testing if she's qualified, she's asked to go to train for a few days on education and to focus on 1 to 2 diseases, and then she's sent back to her village, unsupervised, unpaid, unequipped. She's treated like an amateur, and because of that, her village, which has never had health care, never ever really gets it. We imagined something different. We believed in the power of these community health workers and designed an entire system to recruit, to provide the right training, the right equipment, the right supervision, the right incentives, make the whole system more efficient and effective to deploy a community health worker. So we took Zakpa, ran her through 4 tests before we deemed she was qualified to do her work. She did training not just for a few days for 1 or 2 diseases, but for 6 weeks, and not just for 1 disease, but for 10 diseases, and not just to educate, but actually to diagnose and treat conditions, so that she's able to tackle the majority of what afflicts her community. And then we gave her a backpack full of rapid malaria tests, another 1-minute test, and antibiotics like this one, and stuffed it in a backpack and assigned her a nurse mentor who provides her with weekly supervision to help her grow her skills continuously. We tied all her performance to a paid contract, and so that she could be accountable to the people she serves. And the outcome of all of that is that you have someone that's treated not like an amateur, but just like any one of us would want to be on our jobs, treated like a professional. And because of that, she performs like a professional. She's mastered 50 medical skills. She can treat kids for pneumonia and malaria. She can attend emergency births. The list goes on. And we know, Josh and I do, and many of the people who've worked with us do, that if we could get more support to thousands, hundreds of thousands of community health workers like Zakpa around the world, we could actually save millions more lives where people say it cannot be done. But here's the catch. Around the world, doctors in massive hospitals get the right technology to do their job, whereas community health workers still don't get access to the right technology, especially in last mile villages. And because of that, they can't call for help when there's an emergency. Because of that, they can't call for help when someone's super sick in the community. They can't improve their skills and have the same type of education and technology access that other medical providers do. And the reason is because in last mile areas, which are the worst places to deliver healthcare, the hardest places to deliver healthcare, they also become the hardest places to deploy technology. We thought this was impossible. 3 years standing on the stage, and when I got off stage, in the balcony over there, I met Josh, who had a beautiful idea, as I found, to help solve this problem.
So at Medic Mobile, we're used to having some infrastructure. We're used to having intermittent cell signal. We're used to having a basic health system that we can plug into. And as you just heard, in Konobo district, we were starting from scratch. And what we did was we decided that we were going to build what was needed. We were going to build what was required out of a commitment to connect and support these health workers. And so we came up with a crazy idea. We were going to build our own cell tower using an open source cell tower stack. We were going to use our own radio system to communicate. We would build offline tools that would support the health workers wherever they were. And we sort of found out quickly that once you put that idea out to the world, and you're passionate about it, things start to happen. So just a month ago, one of the leading mobile network providers in Liberia, a company called Cellcom, stood up a tower for the first time in Konobo district. It's the first access point in what will be an expanding network. It's the first time there's been connectivity there in a decade. Next month, our team's headed back with the Last Mile Health team to develop mobile tools to support health workers as they treat different diseases, as they call for help, as they track the families and the households they're serving, and as we create weekly trend analysis instead of annual reports, so that Last Mile Health knows what's happening in every village every week. And the exciting thing is that you all can engage. So as you hear me talk about these use cases and these technologies, please do not be shy. If you have a better idea, come and track us down immediately. We can't afford for anyone in this room to sit it out. And that's because we know what works. We know what saves lives. If you look at the list of services we're trying to provide, it's childhood vaccinations, it's antenatal care, it's treatment for malaria, and it's oral rehydration therapy. We've had that medical knowledge for 100 years, but we've left people out. And I want to show you another view of that challenge right now. So this is global deaths by age, starting with the first few days of life to age 80 and above, global in 2010. This is the distribution in high-income North America. This is the distribution in East Africa. And that's the breakdown in West Africa. I'm not sure about you, but every time that I click from one slide to the next, I can feel the inequity. I can feel that things aren't fair, and I can feel that we are in competition with an unjust state of affairs. And I think the question for this room is, do we have the moral imagination to make things better, to change those charts? And I think that we do. I think this is the exact room for it. And we're going to do it by reimagining how healthcare is delivered in and alongside these remote communities. And I actually couldn't have a better partner and a more inspiring network for this mission and for the work we're going to be doing.
And we've got a chance right now to change the way an entire country provides healthcare for their most remote people. Just this summer, we launched a partnership and made an announcement with President Ellen Johnson Sirleaf, our president in Liberia, to bring a professionalized community health worker like Zakpa with the right technology to every single man, woman, and child in Liberia, no matter where they live. And if that vision aligns with yours, we'd love if you joined us. Ultimately, having been a medical provider in the place I grew up in villages, and also having had the privilege to be a provider in the cities that I ended up resettling in this country, I've realized one thing. Illness is universal. Access to care is not. I realized something else, though. If there was a community, a tribe, as some people would call it, that's going to change that, it's going to be this one because of the imagination and courage to go the last mile. Thank you.